So treatment holidays, I think, are very important. Clearly, we have to balance efficacy of a treatment against that wish to give patients treatment holidays. And there's no doubt that in the myeloma world, there has been a move towards continuous therapy. We've seen that with maintenance, we see that with second and third line therapy. But as we see the success of CAR T-cell therapy and the possibility of treatment holidays, we know they're very important to patients in CAR T-cell therapy. And certainly we see that in Revlimid maintenance, that whilst Revlimid maintenance is very highly efficacious, we have to be very careful to balance that wish to give efficacy of treatment and maintenance versus the impact of patients' quality of life. And I think particularly in first remission, that quality of life is so important that if patients are having any significant symptoms with maintenance, you have to think very carefully about the balance between a treatment holiday versus impairing quality of life in what is a very important time for a patient.